Thanks for being here with me as the show rolls on. Still lots of interesting things happening out there. I want to bring on Allan Bonner, Crisis and Emergency Planning at Allan Bonner Communications Management and a member of the Institute of Public Administration in Canada. Allan, the news of late on this pandemic front has been moving so fast and so quickly that any time you and I would have a chance to try and figure out what we even wanted to talk about, there would be new breaking news that we'd have to deal with here. I want to just for a second get your thoughts on what we found out yesterday, that members of the Canadian Armed Forces had reported up their own chain of command, the absolutely appalling conditions they were seeing in these long-term care homes. And I want to actually focus on one very particular part of this. There was about a 10-day lag time between when the military sent the troops in the field, the actual officers deployed in Ontario, a 10-day lag time between when they sent that report up the chain of command until it was actually acted upon because of bureaucratic delay.
Well, it is sad. You're right. Things move very quickly. And that's just a sad part of a sad story. I've done a lot of work with the Canadian military, and they don't fool around. I was in with our peacekeeping troops in Cyprus one time, and I was not wearing flip-flops around the pool at the Lidra Hotel where our troops were stationed, and I was told in no uncertain terms that the commanding officer, I forget his rank, I think it was Colonel Norris Pettis, said, everybody's got to wear flip-flops. So they don't fool around. Two is one. One is none in the military, meaning you have to have redundancy. And I'm sure when they saw what they saw, they were appalled. And I just don't have anything to say about the bureaucracy. We need fast action. We have not had fast action in a lot of cases. And I don't know what else to say about that, Matt.
Yeah, me neither. And I think when this is all over with, we're going to have so many things we're going to need to look at here. And one of them is going to be communications, but not just communications within government and not just communications up and down the chain of command. But I think, Allan, and this is something you can speak to, communications between the government and the public. You probably saw on the weekend after that big party in Trinity Bellwoods Park that there were three different public health authorities. There was the Ontario Public Health Officers, there was the Toronto Public Health Officers, and there was Premier Doug Ford, and they all went out and had press conferences. And the messages weren't the same. We were getting these multiple daily overlapping press conferences by government officials, and they're having a really hard time getting themselves on the same page.
Yeah, this is a real mess, and I want to say a few sentences about that. One more sentence, perhaps, on the facilities for the elderly. There's this quote that is regularly attributed to Gandhi, and I'm not sure who actually said it, but society should be judged on how it treats the least among us. And those folks, many of whom are veterans, my father-in-law was in a veterans home. They deserve better care. You can't be wearing your scrubs in and out of different homes, carrying perhaps viruses, working in different homes, not having a proper protocol of going in and out, visitors, all this nonsense. I mean, speaking of the military, they would have put an end to that. We did not have proper protocols for that. I live in a hospital area, Matt. You know where it is. It's University Avenue in Toronto. I am taking pictures of healthcare workers in their scrubs on the streets at Tim Hortons. This is not on as well. You talk to an old nurse, they say that this was not allowed. It's not professional behavior, which brings us to the communication question you asked. The government has rarely, if ever, communicated well on emergency planning issues. As you know, I've read 100 urban emergency plans. Many of them reference your need to be able to stay put for 72 hours with a home shelter kit. Well, we're now testing that, aren't we? Well, what is a home shelter kit? They are not defined anywhere, nowhere. The closest we come anywhere near me is Oakville lists the shelf life of food, which is good because what food should you keep? Oshawa lists hidden water sources in our homes, such as in the pipe if the water's off. The best one appears to be British Columbia's 26 steps to preparedness, but they start by saying get a great big bucket, put 3 days of water in a container in it, and you wouldn't be able to lift it. You wouldn't be able to take it with you on an evacuation. It's preposterous from almost day one. Put in packaged food for a lot of people. The average mall walker, maybe packaged food is potato chips. We haven't really educated the public on how to have a lockdown or how to evacuate. Then in this particular pandemic, we have wash your hands, don't touch your face, but sneeze into your elbow, which is touching your face, wear a mask, don't wear a mask, etc. And I want to say one critical comment about an excellent public servant, and that is Dr. Fauci in the U.S. He explained that they recommended against a mask because the data was inconclusive at the time. Now, let that sink in just a second. The data was inconclusive. Yet physicians and scientists are always saying they are in an evidence-based profession where they go with the data. Well, if the data was inconclusive, you could have said put that mask on the top of your head and wear it like a hat to keep the sun off, or put it on the back of your head and walk around backwards. You know, if you don't have the data, you don't guess. The lack of evidence is not evidence of a lack of information. You know, if you don't have the information that dogs can transmit this, which we didn't at one time, and then you find out later they do, you don't say there's no evidence that pets can transmit it, because that'll make people think that they can't transmit it. So, wow, I mean, I could go on, but it is astounding how poor governments are at communicating what it is we should do.
We've got about a minute left here, but I want to put this question to you. You've been in the trenches on this for a while. When this is all over, we're going to do any number of inquiries and commissions and reviews and task forces to kind of review the response for this. What would it actually take to improve communication? I mean, what would you have to do to get that done?
Well, it's funny. It's pretty simple. It's the kind of things that a broadcaster or a journalist like you know. You don't just get to say it once and it's over with. I mean, how many times do you sometimes do the same story from a different angle, and you wrestle with yourself about what is the new angle, because you've heard it many times, but you know that some of your listeners or readers have not encountered the information. So LED trucks with signs on them saying what to do. I think that Ontario's use of on the phones was great. Bus shelter signs by the City of Toronto was great. So, I mean, they're trying some new things, but they need everything. Billboards, doorknob hangers, loudspeakers. They need everything multiple times, multiple channels, because obviously many people are not getting the information.
Yeah, and there you go. And Allan, I mean, to answer your question, if it's a big story, like something like an Amber Alert, and if I'm on the radio when it's out there, I would mention it every 15 minutes. And at the start of every segment, after every commercial break, I would spend a minute recapping the story. And that's, you know, because you're absolutely right. Repetition is the only way to drive these messages home. Allan, good to talk to you, man. Appreciate your time as always. We'll check in again soon.
Stay safe.
You too. Allan Bonner, my guest here on the show.